Assalamu alaikum, the communication day. The scenario, first scenario, Alicia Sanders, 31 years, pregnant, second trimester, presented with severe short of breath and diagnosed as having pulmonary embolism. The consultant advised to start her on low molecular weight heparin. Please sit with her and explain the management plan and address her all concerns. Okay, if you're ready, Dr. Hassan.
Yes,
We'll
I'll start.
start in a second. Yeah, I will share the timer, then you can start straight away. Yeah, here you go.
Hello there, I'm Dr. Muhammad, one of the doctor in the clinic. May I know you confirm your name and age, please? Hello.
Yeah, Dr. Ansia. Dr. Nazia, sorry, Dr. Nazia. Wait a second, please.
Right.
Dr. Nazia. Hello, Dr. Nazia. Yeah.
Oh, I had my mic with.
Yeah. Can you talk now, please? I cannot hear you if you are talking.
Hello.
Yes. Yeah, now clear. Yes.
Yes.
Can we start?
Can
You
we start
ready?
again? Yes.
Yes, please. Okay.
Hello, I'm Dr. Muhammad, one of the doctor in the clinic. May I know your name and age, please?
Yes, doctor. I'm Anisha Sanders, and I'm 31 years old.
Okay. So, Miss Sanders, we are here to talk about your health condition. Is that okay with you?
Yes, it is.
Okay. Before starting the meeting, do you want somebody to join today with us?
No, I'm okay by myself.
Okay. And how are you doing now?
I'm okay. I'm currently doing fine. Thank you.
That's good, actually. So today we are going to discuss about your health condition that you are pregnant and you are in your second trimester,
Yes.
and yes, and you got breathlessness while you presented to us. Okay,
Yes, doctor. It was very scary.
yeah, it must be. Okay, so what are your expectations from today's meeting?
Yes, so doctor, I don't know what's happening to me first of all, and it's so scary because I am worried about my baby, and what are you going to do about me, and if I will be having this again. So, please, could you explain?
Okay, so Miss Sanders, actually, when you presented to us, yes, you're right that you were very short of breath. And what happened to you during pregnancy? Because there are some chances of this condition, what we call as pulmonary embolism. Don't bother about yourself with the name. It's a medical term for a condition in which there are some clots. You mean your blood can clump, and it can block your arteries in your lung. Maybe I'll draw for you, and you will get better understanding. So,
Yes.
how I'll draw this one? I don't know how to draw. Can you see it?
Yes, I can.
Okay. So these are your lungs, and in these lungs you have small blood channels, okay, very very small blood channels, and those blood channels can be blocked by a small clump of blood, and your pregnancy actually predispose you to this condition, because in pregnancy your blood is already the blood is not in a normal form, so it can cause clumping of blood, and that causes blockage in your artery, in your lungs, small arteries of your lungs, and because of that blockage, you cannot get enough oxygen to your body, and that's why you become suddenly with shortness of breath.
So
Are you
you're
getting
saying
what I'm
that
saying?
I got this because I got pregnant.
Yes, there are certain conditions also which predisposes to you about. I don't know if you have for that, but actually, pregnancy itself can aggravate this condition. Yes.
Okay, but then not many pregnant people are also having this, right?
Yes, usually, yeah, usually it is a rare presentation. Not everybody can have this, but it can happen to anybody who is pregnant.
Okay.
Yeah.
So, doctor, I'm really scared. Do you think I'll be having this again?
See, Miss Sanders, the thing is, we are going to have some test with you, and we'll see if there is any other condition running in your body. But right now, I can say that there is. I cannot say that with 100% surety that it can occur, but there is chance of occurring next in your pregnancy.
Oh
Is that
no.
okay with you?
No, that is not okay with me. Can you do something so that I do not get this again?
I'm sorry to hear that. It must be very concerning and upsetting you. Actually, if we know the condition which you are having, I don't know exactly your medical history, but if we know that one, so we can do something. Yes, we can do something in your next pregnancy, and even this one. So now what we are going to treat you is give you some injection. So your this pregnancy can go smooth, and that is what we call as heparin. Have you heard about this one?
No, I did not, but you said that this is an injection. And doctor,
Yes.
I ever since I was a child, I have always had really severe panic attacks whenever I see injections.
Right. Actually, this injection is not that injection which you think about, because it will be just injected under your skin, and it will be a very thin needle, so it will not cause you the pain the usual injection cause you. Does that sound good for you?
Ah, no, still, doctor, I wish someone else would give it to me. I mean, can you like somehow not give me the injections, something else, maybe medicines?
Actually, you are right in your saying that you are panicking about the injection, but this is what we have decided, and this is in your best interest that we should give you this injection, and believe me, it is really a less pain than compared to the other injection, because it's small and it will be given under your skin. So
But
it,
are you suggesting that I come to your hospital to get this injection?
No, actually, initially, yes. Initially, while you are here with us, we will inject you, and we will tell you the technique. It's very easy to inject yourself. Like if I tell you that some people for diabetes they are doing by themselves. A lot of people doing this, and it's very easy to inject yourself.
But it is impossible for me to take this by myself and to come to your hospital every day to take this. It's also very troublesome for me because the traveling by road is difficult for me.
Okay, in that case, we can think about arranging some social care worker or staff we can arrange for you to somebody can inject you with this one. But I'll get back to you if we can help you through social health worker or
Okay,
any.
but before I agree to it, I'm really worried about my baby. This medicine, every medicine has side effects. I don't want to take any medicine during my pregnancy. It may harm my baby.
I really appreciate your concern about your baby, and but I assure you that this medication is very safe in pregnancy and for you and for your baby also.
Okay, but what if I don't take it? What if I don't take it? How bad can it be?
It can be as bad as it
2
happened
minutes
last
left.
time.
Okay.
Yeah, we are
But
giving you this in order to prevent this not to occur again.
okay, so without this, I will get this breathlessness attack again.
Yes, there is a possibility. Yes.
Okay. If you
Yes.
say so,
Yeah.
I will try to consider.
Yes. Thank you very much. So, do you have any other concern, Miss Sanders?
I'm wondering, this medicine, I think I've read over the internet that this medicine may cause some bleeding.
Actually, this medicine, this injection which we are going to give you is the other type of medication. Yes, it can cause, and this also can cause, but there is very, very, very less chance that this type of medication will cause you bleeding, because it's safe and it is yeah, and it usually does not cause bleeding.
Okay, if you say so,
Yes. Do you have
I'll
any other
consider.
concern, Miss Sanders?
No, I don't have any concerns. I think I'll think about it, and if you say if it's safe for me, and then this is what I need, then I will try to take it.
Okay. So to summarize, that you think and you agree that we'll give you, and we'll try to arrange for you some social worker to give you at home this injection. Okay.
Yes, I'll think about it.
Okay. Okay. Thank you very much, Miss Sanders.
Okay.
Okay, thank you, Dr. Ahsan, being volunteer today. And thank you also, Dr. Nazia, for preparing the scenario quickly without any preparation. Let's hear the comment from you, then I will comment.
Well,
You can comment,
actually,
please.
I have this written here, so it was already written in my book, so it was easy to collect. And
Okay,
this scenario was done in one of the
yeah.
astrocyte classes. And the thing is that the patient, first of all, she's like asking that why this happened to her and why other pregnant women are also not having it. So we have to indirectly take history like this may happen if clotting problems run in families, and
Yeah,
if
but without taking history, with
yes.
enumeration. Yeah,
Yes, like pregnancy is one of the risk factors. Like
exactly,
there's a
yes.
5 to 10 times higher risk with pregnancy, but we don't say the percentage. We say that she will ask that why other pregnant women are not having it. So the answer to that, the yes, pregnancy itself uh, causes puts you in risk, but also some people have clotting problems that runs in the families, and also with each new pregnancy the risk gets higher. So multiple pregnancies, since she this we will tell her that if you are getting pregnant multiple times, the risk is increasing. So she may say that yes, this is my third pregnancy, something like that.
Mhm. Yeah.
And then she has panic. Other concerns are really nicely met. And she will also ask about like how long will I have to take it, is it safe for my baby, what if don't want to take it, and she will talk a lot about how she's scared of needles and she doesn't want to
Mhm.
take it by herself.
Yes.
And she will ask that will I have to take it even after the delivery. So the answer to that is that she will have to take it for few months, actually 6 months afterward.
Mhm. Yeah. Okay.
Yes.
And did he address the injection properly? I mean, the social worker. This
Yes.
is it the
Also,
problem of social
he
worker?
can
Yeah.
add that
Home care.
her yes, her family members can be taught to give her
Exactly.
the injection. Yes.
Yeah. But from the hospital team, it's a
Yes.
home. home care team, right? Not the social worker, right?
Uh, I- I'm not sure about that, but they said that the family members can participate,
Yes,
and she
exactly.
can come to the nearest GP
Yes,
or nearest hospital. She doesn't have to
exactly.
travel all the way to there. She can take it
Exactly.
from anywhere.
Yeah. So I agree. Yeah. First solution, you have to offer some family member to be educated how to do so, and
Yes.
they can do or she can do at home. The second
Yeah.
option, if he said no, I'm alone, I'm living alone, any friends, anyone, neighbor can know, and we can teach him. If no at all, we can offer now, as you said, any neighbor clinic or any home care near to you or nearby to you. But social worker is it's not the team can help in this regards, Dr. Hassan, okay?
Okay.
Yeah, so you cannot say our social worker will help you in this problem. You can offer, as Dr. Nasia said, any family member or any friend or any clinic nearby, or we can offer the home care. They can visit you, but social worker is not the team assigned for this problem. This is regarding the injection. Another point you missed, Dr. Hassan, the social history. Didn't take any social history here. Smoking, alcohol, right?
No, actually, time was near to finish
Yeah, but instead of recapping or summarizing, you can't take this history.
because when I start summarizing, it was already 9 minutes and 30 or 40 seconds. So I
Believe
thought
me,
I will.
even seconds, and you mention these things better than missing it. Even seconds. You know, if you start to talk and he said time, they will know that you try to address them rather than skipping them at all. It might be here as a hypercoagulability cause, I mean the smoking. It might be, right? So you can talk
Mhm.
about smoking if she is doing so. At least
Right.
smoking,
I try
because
to do a
yeah.
method where I don't like if I'm running out of time and I have only few seconds left. Instead
Uh-huh.
of asking the patient, I just as fast as I can, I say the line like, "Smoking is very injurious to you. If you
Yeah,
are smoking."
exactly.
If by chance you're smoking, we have a very good smoking cessation clinic. If by chance you're smoking, please tell us.
Mhm.
I can refer you to there.
Perfect. This is another way to
Yes, it's a
mention
good idea
without,
actually.
yeah, good idea. The other thing, the job, always remember the job. And you can also talk about travel. It's difficult to travel in the coming period because of the risk of another clot. Okay.
Yes,
I
but
prefer
actually,
to do
so
so.
many concerns.
Yeah, it's okay. That's why whenever you hear 2 minutes left, you start to address these concerns. If she doesn't have concern, you have to ask these questions. Do you smoke? Do you drink alcohol? With whom you are living? Do you need any support? What's your job? And finally, if you remember, either travel, like in this scenario, or driving in another scenario. Okay.
Right.
But in general, you did great as first attempt. You said this is first time, right?
Yeah,
I
in the
believe
group
you did
course.
great. Yeah, perfect.
Yes,
Really.
he met all
Yes.
the concerns like correctly, like, and
Yeah,
the actual scenario when they did it, that's how they addressed most of the concerns.
exactly. Yes, I agree. Thank you, Dr. Nesia, for the scenario.
Thank you very much.
And also
Thank
thank you,
you.
Dr. Hassan, for the practice. I will send you now a scenario to practice with Dr. Nasia. I will read the comment first. Uh, okay, let's go to, yeah, driving travel. Yes, of course. As I said, thank you, Dr. Muhammad. It's valid point. You have to mention it. Apart from that, after delivery, shifting to oral therapy may be offered, isn't? No, they continue what we learn in part two. Yes, we can shift to warfarin, but still warfarin, I think it's breast secreting. So it's not preferred. They will continue on low molecular weight heparin after the delivery up to 6 months, as Dr. Alessia said. This is what I heard also from the same mentor. But I don't know if someone has the guidelines, he can share with us. What I remember before, yes, you can shift to warfarin, but when the mentor mentioned, yes, you can continue low molecular weight heparin for 6 months after delivery. If not lactating, I think she can take warfarin. Good questions, by the way, and it might be a concern during the scenario. Okay, Dr. Ahsan, I will send you the scenario now. Anyone has
Right.
scenario you want to practice or you want us to practice it? Any scenario? Any interesting scenario, even not interesting one, he want to do so, and he want to know how to do it.
Dr. Bassam.
Yes,
Hello, how are you?
Alhamdulillah, fine.
I'm ready, but not 100%. I have no ready scenario. I have to prepare. But if you have a ready one, I can practice with Dr. Nazia, I think.
Dr. Muhammad?
Muhammad, yes.
No, she will practice the one because she already gave us a
Okay,
scenario. Yeah, if you have scenario, you can give to her. You have?
just a moment.
Yeah, please.
Just a moment.
It's okay, take your time. So Dr. Ahsan, if Dr. Muhammad has scenario, he can practice it as a surrogate, and I will compensate him a scenario later on,
Okay, okay,
another
okay.
day. Now you practice free.
No, I'm going to do, or Dr. Muhammad will?
No, Dr. Muhammad will be the surrogate for Dr. Nasir.
Okay,
If he
okay.
has scenario, if he doesn't, I will prepare a scenario.
No problem, no problem. Thank you, Dr.
Most welcome, Dr. Ahsan. And I think this is good time to start practicing with us. You did it as a first time, always being the difficult and the most difficult one.
Yeah,
Later,
yeah,
yeah. So you can overcome this stress
inshallah,
by practicing once.
inshallah.
Did you find it, Muhammad?
Just a moment.
No.
Dr. Bassam,
Uh-huh.
this is the scenario.
Okay, you sent it. Perfect. 65 years old female patient, Mrs. Smith, has been experiencing symptoms short of breath, fatigue, and swelling in her legs. She has a history of hypertension, diabetes. After recent tests, the diagnosis of heart failure with preserved ejection fraction is confirmed. You as a doctor need to explain the diagnosis, answer any question, and discuss the management plan. Perfect. Nice scenario. Also related to our scenario as short of breath. Dr. Nazia, I will give you 1 or 2 minutes to prepare. Is that okay?
Okay.
So you'll be the surrogate Dr. Muhammad, okay?
Okay.
Thank you, Dr. Muhammad, for volunteering for that. And thank you, Dr. Ahsan, for being also volunteer earlier. 2 minutes, then you can start. Anyone has comment or doubt about previous scenario or any question regarding any communication? Yeah, Dr. Ahsan, I remember one point. When you start to explain the disease, I prefer to give her like something it's breaking bad news because pulmonary embolism, it might be serious, right? So you can tell her, I don't have good news for you. you have a condition called pulmonary embolism. Then give her as warning shot, then wait for a second, and you again, which is silent, golden silence. Then you will tell her, have you ever heard about pulmonary embolism? She will tell you, no, doctor, it's first time ever to hear about that. Then you can tell her, okay, I will explain to you what is the pulmonary embolism. Don't bother about the name. It's serious condition in which some of the blood channel, let me draw for you as you did that. Exactly. One of the blood channel of the lungs being blocked by a blood clot. It happens sometimes in pregnancy, and pregnancy one of the risk factor. However, there is other risk factors. In some families, there is conditions might be the one responsible for this clots. So it might be as a familiar condition running in families. Don't take history. Just enumerate the possible causes. Other condition might be related to certain disease, and it might be related to antibodies and defense system. I mean antiphospholipid, but don't mention the name. Just explain the possibility of other pathologies. Antiphospholipid antibody syndrome, I mean, there is some change in your defense system might attack your blood and blood channel, and it might present it with this condition. If she has any of these possibilities or any of these underlying pathologies, she will tell you, yes, doctor, I have a familiar condition. My father has a clot and they are diagnosed with blah, blah, blah. Or she will tell you, yes, doctor, I have a disease called systemic lupus and I am diagnosed earlier. This is the way how to ask, also how to explore without any question. So you just enumerate the possible causes and she will tell you after that. If not, at least the pregnancy itself can cause the hypercoagulability because of the low fluid and increased blood viscosity, decreased venous return, and so on. So it might be the pregnancy itself, it might be the risk for the pulmonary embolism. Is it clear, Dr. Ahsan?
No, but Dr. Basim, I did not take it as breaking bad news because this already happened and she is being treated for this one. This is not, I think, not chronic condition.
It's not only chronic condition to make it as breaking bad news. Pulmonary embolism, one of the serious presentation of life-threatening condition, right? Some patient died with pulmonary embolism. So it's
Yes,
not,
you are right.
yeah.
But it already happened and she is being treated and she is stable now. That's why I did not take it as breaking bad. I took it as an explanation of what happened to her and what we are going to do.
Okay, again, let's say the causes of breaking bad news or when the situation to present as breaking bad news. Any acute condition which is serious might harm or might threaten the life. Can do it as breaking bad news. Because if recurrent, if this pulmonary embolism recur back, it might harm or it might threaten her life. So it's my opinion. You can do it as breaking bad news.
Actually, the
Yes.
mentors at Astroside also said to do it like breaking bad news, but not with a lot of warning. Just one warning would be enough.
Okay. Thank you, Dr. Naz. Any condition that might threaten their life, you can do it as breaking bad news because you might speak with her daughter with after the patient or this patient already passed away because of pulmonary embolism. You don't, and she came with severe short of breath. This is my opinion. And again, everyone has his approach he want to follow, or he can do what I'm saying. Okay, Dr. Hassan, it's okay to mention it without, but I prefer to do it as breaking bad news. Okay?
Right. Yes.
Okay, thank you. Let's start, Dr. Nis and Nasia, are you ready? Dr. Nazia?
Yes, one
Dr.
second.
Muhammad, you ready?
I'm
Okay,
ready.
yes, I'm ready.
Yes.
Yeah, here you go.
Hello, Dr. Zareen, one of the medical doctors in this hospital today. So, am I talking to Mrs. Smith, 65 years old?
Yeah, hello, how are you, doctor? Dr. Zuhair?
Uh, yes, okay. So, Mrs. Smith, we're here to talk to you about your medical condition today. So, before we begin, to be on the same page, can you please tell me how much you know already?
Okay, doctor. I have visited one hospital nearest to me. I was complaining of difficulty in breathing and some swelling in my legs. One GP doctor saw me and mentioned that I have a problem in my heart. That's all I know.
Okay, so yes, I'm very sorry for your suffering, and you are well up to date with your condition. So we have run some tests on you, and we have a diagnosis for you.
Mhm.
So I'm afraid that it is not a good news.
Why, doctor? What's happening to me?
Okay. Yes, so you're having a condition we call this heart failure. Are you aware of the term?
No, I didn't know what's heart failure.
Okay, so let me explain it to you.
You mean
So
my heart is not working?
yes, something like that, but it's with preserved ejection fraction. Don't bother about the term. I'm explaining it to you in further detail. As you already have an idea that your heart is not properly pumping. The function of our heart is working to pump the blood throughout our body.
But the GP
So,
doctor told me that the pumping action is normal, and he said to me in number it's about 60%.
yes, it can happen that the pumping action can come as normal, but yet still it is not properly working as it should, which is why you're experiencing the shortness of breath and you're having swelling in your legs. So that is why your heart is not even after pumping action is showing that it's good, but there is actually a failure of in your heart with your heart. Do you understand?
Okay, yes.
Okay, so but do not worry, we are here for you and we'll be doing everything we can to help you with reduce the symptoms. So we have already formed a team of specialists for you, including our heart doctor and our a specialist nurse and dietitians. And so we have a good plan for you.
Thank you, doctor. Doctor,
Okay.
my brother also has high blood pressure and high sugar, but he's not complaining of such illness.
Okay, I'm very sorry for what your brother is going through, but it is possible that his high blood sugar and high blood pressure has not affected his heart yet. Because you know, high blood pressure and high blood sugar uh, it may affect any organs in your body. It doesn't always have to be the heart, and there is no time limit when it can happen. So all we have to do is maintain a healthy lifestyle, and we have to work to prevent ourselves from having this in the future, right?
Yes,
Do
thank
you?
you.
Okay. So we also don't want you to suffer any further, and we want you to your lifestyle to be modified in a well manner. So I have some advices for you.
Okay.
Since you're having this swelling in your legs and you're having shortness of breath, it means that there is some water buildup in your body.
Mhm.
So I advise that you restrict your water intake. We will give you we will refer you to our dietitian who will give you a diet chart with further detail on this. Okay, and we'll be giving you some water pills as well, so that not too much water is collecting in your body, right? And you need to have a well balanced diet, and not take much fatty diet, and not take much salt, and uh, okay, are you
But I
getting me?
cannot, doctor, I cannot live without salt. I love eating red meat and barbecue.
I understand. Yes, but you see that we are not. I'm not telling you to totally cut down on salt, but I'm telling you to like reduce the salt intake and reduce your red meat intake, because if we do not intervene, if we do not come up with a good balanced diet for you, this will progress further. Your heart may become even more less functioning. Okay, and it may lead to other complications, like you may get a blood clotting problem in your brain. You may get a blood clotting problem in your heart, and many other complications, like uh, difficulty, problem with seeing things, and it may also affect your kidney. So it is very necessary for you to have a healthy lifestyle. Do you
Doctor,
understand?
is there any pill you, just single pill? I need only single pill to help me with this illness. I don't need too many medication. Just single pill.
Well, I'm not sure how many pills we are prescribing you, because our heart doctor and medicine the specialist and um, uh, diabetes specialist, everyone will discuss your issues, and we will come up with a prescription, hopefully with not too much medicines.
Okay.
Okay. Okay, and if in any case you feel any breathlessness, and if you see any sudden changes in your weight, and if you see that you're having leg swelling, so not having proper urine water work output, so I advise that you contact us and come to us immediately.
Doctor, we have many family members complaining of heart illness, and there are reported case of death in our family because of cardiac problem. May I die with this illness?
Okay, your concern is very valid. I can see that you're worried, but I do not think that it is. You're thinking too early about this, and I think that with proper intervention and proper lifestyle changes, you can live a nearly normal life, and there is no need to worry about your lifespan if you maintain a very healthy lifestyle. Okay.
Okay, okay. Doctor, I saw some reports on websites mentioning one of the treatment of heart failure is the transplantation. Do I need this transplantation?
1 minute
Transplantation.
left.
Okay, you have raised a good concern. Well, you're not at that stage. Your heart is still functioning, and with medicine, you can live a nearly normal life. So, um, uh, and besides, heart transplant is a much big operation, surgery with much more complications, and you may need to have many more medicines if we go for the heart transplant. It is a big surgery, but your now your with your current heart condition, it is not so bad.
Thank you, doctor.
Okay. So may I ask you some personal questions?
Yeah, sure. Yes, sure.
Do you smoke?
No,
Do you drink alcohol?
no.
Okay. And in case of any financial aid, we are here to help you with any financial aid in case you need something. Okay.
No, I'm fine with this.
Okay.
Okay,
So
time's
do you have
up.
any more concerns?
No more concern. Thank you, doctor. Thank you so much.
Okay. Thank you.
Thank
I
you,
will give
Dr.
you
Nazi.
some. Yes. Is the time over?
Yeah, time is up. 10 minutes, 30 seconds.
Okay. I have never done this case.
No, perfect.
Thank you so
Really,
much.
as a first time, perfect, really. Let's hear
I
Dr.
have.
Muhammad comment, then I will comment.
Yes. Okay.
Dr. Nazi, thank you for this presentation. Actually, you did well. You covered many topics in heart failure with preserved ejection, but one point in pathophysiology, the pumping action of HFpEF is normal, but the
Yes.
relaxation or the relaxation power is impaired. This is one
Okay.
issue, and the complication you covered well, all of the symptoms being covered totally. The management plan was perfect, non-pharmacologically. The pharmacological I was meaning by this pill is the Lasix.
Yes.
Lasix pill.
Water losing pill. Yes.
Yeah, water pill. You did well, and I think you were perfect. Yes,
Okay. Thank you.
you covered many things. Yes.
Yeah, thank you,
Thank you.
Dr. Nadia, for taking the case. And of course, thank you, Dr. Muhammad, for providing us a case, which was an emergency case. No one prepared. Anyway, it's a nice case, by the way. We didn't practice this scenario before.
Mhm.
And Dr. Nazia did it really perfect from the start till the end.
Yes, this was a really like new case, and it was I appreciate the case
Yeah,
and the chance to
this is the
perform.
benefit. Yeah, this is the benefit of practicing in many sessions and many mentors and many partners. It's not only one
Yes, it
partner
was a
because,
really good brainstorming.
yeah, really. And you prepared it very well in short time, and you address every concern properly. You start by the non-pharmacological decrease salt, although he doesn't like to reduce the salt, but you ask him not to inhibit at all, just to reduce it, along also with the dietitian advice in the team, along with the heart doctor and other team member. The pharmacological, I want to add only these 2 points. I wrote it because I always forgetting while commenting. So when he asked you about I need to take one pill only, yeah, you can say, as you said, your concern is valid, and I will try to discuss this with the heart doctor, along with the kidney doctor.
شامبين وبتاعها قرصة بسيطة كده.
Okay, then anyway, nowadays there is a lot of combined medicine, means that you can take two medicine in one pill, and this is a real option, right? Real solution. So we are trying to minimize the tablet number or the pills number by making a combination of medicine together. This is if he mentioned, as he said, Dr. Muhammad, I need to take one or two to minimize, I mean. So you can say, yes, it's valid, and we will try to do this. And nowadays, there is a lot of company offering us a lot of option to be combined together. And you can take medicine or two medicines in one tablet or in one pill. Okay, but don't mention name. I like when you didn't say anything. Is it Lasix? Is it beta blocker? Because it's not mentioned in the scenario. However, if they mention, give him the management option, you can talk about some option of the pharmacological, like beta blocker, like diuretics, but it's not mentioned here, so no need to go deep with this. You can refer him to the team, and the team will provide us the medication. I wrote also here, when he told you about his brother, always in any scenario, any surrogate give you example of one patient in his family or in his family member always ask about him. This is one of the welfare point. He will tell you, my brother was suffering of short of breath the same as I suffered. You address well. You said, I'm so sorry for your brother suffering. Yes, this is good. Add one more question. And how is he now? This is one of the points you can show some welfare through this point, through this question. How is he now? Is he fine? Does he need any support? Yeah, it's not the target or not the task, but at least give him offer help to help his brother as well. Okay. Then he addressed another point with his family. I'm worried some of our family. So you can address it more. Any condition running in family, are you or any family member suffering? Let them check up. We have our team here expert just to show some sympathy and empathy and some care for his family member as well as for him. Okay, Dr. Nazia?
Yes,
Yeah.
the
Smoking
very
and
good point. Very good point.
yes, perfect. Smoking and alcohol, I prefer to do it whenever you hear 1 minute or 2 minutes left. I mentioned it late, but whenever you hear 2 minutes left, address again this social. Any smoking, because the smoking harm the heart also, and the alcohol as well. The job you can do if he has any problem, but don't specify the financial. Maybe he has, or most of them have good financial support. So you can offer any support you need. How do you cope with your life activity? You can say also some hobbies. If he's interested with hobbies, you can tell him about the hobbies. If he's interested to do some aggressive exercise, not to do so because it might harm the heart. But walking as simple activity, fair enough for him to have good lifestyle. Apart from this, I think you did great. You have any question or comment?
No, just a very good point.
Thank you, Dr.
I did not
Nazir.
think about those points. Yes.
No, but what you did is great. You cover as first time and first practice with
Yeah,
me
sure.
and first practice this scenario. You did it great. Really. You have any comment, Dr. Muhammad, for him?
Not specific. Cardiac rehabilitation, Dr. Fiba mentioned this is a very
Yeah.
good point. Yes, I'm
Yes,
with
it's
that.
good.
I have to follow some cardiac rehabilitation program.
Perfect,
I
yes.
have to have some special nurse in my home in case of emergency. And my following, if sudden shortness of breath again happened to me, I have to visit hospital again.
Mm-hmm. Safety netting, yes. Okay, well done. Thank you, Dr. Muhammad, for the scenario. I promise you, we will take the communication on Thursday if you are free.
Yes,
Uh,
hopefully I
yeah,
will
with,
do.
with someone. But as a good start, yeah, you did it well.
This is the first time, yes.
Yeah, but at least you broke this stress. I know it's
Yeah,
difficult to practice, but if you start as surrogate, next time you will be a candidate and you will do great, I believe.
inshallah. Inshallah.
Inshallah. Inshallah. So you have the opportunity on Thursday with anyone
Okay.
interested also. Thank you, Dr. Muhammad, for the scenario.
Okay.
Some comments here. Dr. Marwa said, yes, your heart pumps well, but it's stiff. That means it's properly filled, not properly filled with blood. Yes, which is diastolic dysfunction. Perfect. Dr. Salma also, if the heart pumps normally but is too stiff to fill properly, yes. So pumping well but pumping less. Perfect. Same explanation. The next point by Dr. Nazia. Yes, Dr. Daria.
Good evening. Assalamu alaikum.
Mhm. Walaikum
Uh,
salam.
I have some
Mhm.
something it might help to solve the concern that, but he's when he the surrogate said, but the GP said the my ejection fraction is okay or something like that. I'm not sure about the phrase.
Yes, it was 60.
Yeah,
Okay.
yeah, okay. So from the start, when to explain that, I prefer to write down or use your hands to explain the function of the heart from the start. Let me explain what the heart failure is. The heart failure is the main function of the heart to pump the blood to the body. When the amount of blood is less than the needs of the body, that means the heart failed to do that. So how that could be? For example, I will put my hands like first the heart need to like relax to accommodate blood, then pump the blood to the body. So the muscle of the heart need to relax, then to contract on and to pump the body. In your case, the pumping function is fine, but to relax the muscle of the heart and to accommodate the blood from the lung, it's less than it should be. So that the less amount is ejected or pumped to the body, that means it's still the heart failed to do that. So that's what we called heart failure with preserved ejection fraction. Let the surrogate or the patient knows the name of his disease, because at the end you'll give him the a website to read about the name of the disease. So we need to say it as the candidate do very well, the name. Okay, and he said that yes, there is many parameters, and the main thing that we need to do for the knowledge about the heart failure, it's not only the ejection fraction and not only the peptide. I forgot the name. Oh, my brain. Okay, so if there is some parameter is not with the symptom as some parameter, then we could say this is a heart failure. Okay, so we don't need to go deep to explain the all tests that we need to do for the heart failure. Just they found that from other parameter that your heart is failed to do the job. Okay,
You mean the
and
systolic pressure, the systolic dysfunction.
nitric peptide. Okay,
Okay, BMB.
yeah, yeah.
But I guess it's the systolic dysfunction. The
Yes, the
heart
diastolic as
failure.
well.
Yeah, yeah.
Yeah, for the explaining that the patient we didn't need to
Yeah, yeah.
explain all that. Just
Mhm.
for if just in case asked, there is many other parameters by blood, by ultrasound of the heart, by we could do many things that we could at the end. So we didn't have a lot of information that what have done for the patient in the scenario. So just keep it like just like that. And then this the surrogate from the couldn't yeah, ask me like this question. And if he asked and I didn't explain that well from the start, I could explain it to him later. Okay, and just the plan of management, we could say the highlights, it's a lifestyle, the rehabilitation program, and the medication, and it could be surgical, but not at the moment. This is a highlight, and because there is nothing is mentioned during inside the scenario. So we just that we need to do is to detect what his lifestyle is, as the candidate done very well, and smoking, and give him an idea that to read to, because there is association with the hypertension and diabetes. We need to control them, that to improve the outcome, and he needs to know that there is no cure for heart failure, just to treat the symptoms. This just to highlight that is no cure from heart failure, but there is usually the plan is to treat the symptoms through blah 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 lifestyle as a candidate done, and to be things like systematic way that, and then to the comorbidities to optimize the treatment of comorbidities. Okay, and then the program and follow up and give him the website and brochure about his disease, and the community and like groups to just in contact and something like that. Thank you. Sorry for
Okay,
lots of
thank you, Dr.
questions.
Darius. Thank you for clarification. Uh, Someone asked in the comment about, yeah, what missed by Dr. Naza. I mentioned already the alcohol and the smoking, and Also, cardiac rehabilitation, as Dr. Muhammad mentioned, and Dr. Phoebe as well, she mentioned it. Exercise, yes, to reduce exercise, I mentioned. If he asked about, and it might be also one point to be raised by the surrogate, the intimacy. He might tell you, doctor, will I do my usual intimate relationship or I have some restriction? You can give him some precautions if he has taken any medication for blood pressure, not to take any medication for the intimacy. I mean the sildenafil itself. This is as red flag and safety net. Dr. Goda mentioned split as option, yes, but it's not mentioned in the scenario. So don't offer a lot of medicine. Just say the cardiac or the heart doctor will give you the best interest for your condition.
Dr. Bassem, Dr. Nazim mentioned the smoking and alcohol. I was free of those. But one point in regards to BMP in heart failure with preserved ejection fraction, usually the level of BMP is lower than the level of BMP in heart failure with reduced ejection fraction, or in majority of HFpEF, they have normal BMP. Okay, so BMP usually could be normal or mildly elevated in HFpEF.
Yeah, so you mean it's diagnosed by the echo, not by the
Mainly echo,
test.
yes.
Yeah, echo only, okay.
And the type of surgery, if present in the scenario, the type of surgery in HFpEF is atrial septostomy, making a hole between the two atria. One of the major surgery, but usually not done in usual.
Okay, what about CRT? Cardiac
CRT
resynchronization.
and ICD has
Yeah.
no, because both CRT and ICD should be placed when ejection fraction less than 35.
Less than 35, yes, exactly. Yes, you're right. Thank you, Dr. Muhammad.
Welcome,
Very
Dr.
nice informative scenario, really. And well done by Dr. Ahsan and Dr. Nazia today. Thank you for the scenario, Dr. Muhammad, and for offering us a scenario without practicing. Anyone has comment before ending the session? Thank you, Dr. Daria, for your comment as well. Thank you, everyone, for participation today and attendance. See you tomorrow.
Thank you,
inshallah.
everyone.
Thank you,
Thank
Nadia.
you.
Thank you, Dr. Nadia. Thank you. See you tomorrow, inshallah, with clinical day. Good luck and good night. Assalamu alaikum.
Salam.